To commence with today's formalities, let me now invite Professor Vajra Disanayaka, the Chairman of the Commonwealth Center for Digital Health, to address the gathering.
Good day, everybody. Welcome to the 5th edition of the Commonwealth Digital Health Awards. What a journey we have been having. Starting in October 2016 in Colombo, Sri Lanka. Today, 5 years down the line, we are at the 5th Commonwealth Digital Health Awards. We began by recognizing digital health innovations, but as we went along, we broadened our awards categories to recognize other determinants of health. To recognize nutrition, we have NutriTech Awards. To recognize education, we have EduTech Awards. To recognize finances, we have FinTech Awards. And to recognize the environment, we have Ecotech Awards. Not only that, 2 years into the pandemic, there is widespread adoption of various technologies to support the fight against the COVID pandemic. So we've got a special category award of awards to recognize those as well. So the Commonwealth Digital Health Awards are evolving. We are recognizing more and more innovations that are determining the health, that are making sure that our populations remain healthy. The awards have grown from year to year due to the commitment of several individuals, and I'd like to place on the record their contribution. Dr. Pandula Siribadana has been leading our awards on behalf of the Commonwealth Center for Digital Health. So Pandula is the power behind these awards. He's been ably supported by Tony Singaraya, the Chief Financial Officer of the Commonwealth Center for Digital Health, and Anup Singh, the CEO of the Commonwealth Center for Digital Health. I'd like to thank both of them for their dedication and support. Tony has played a pivotal role in determining and refining and the evolution of the matrix that we use in selecting awards. So I'd like to mention that specially and thank him for the efforts that he puts year after year to refine our matrix so that we recognize the best out of the best. Behind the scenes, the judges make an enormous contribution. I'd like to thank all the judges led by Professor James Batchelor, who've been doing a tremendous amount of work to ensure that the award selection process is meticulous. As the Commonwealth Center, we are dedicated to not only recognizing the awards, but to making sure that we help the award winners go forward. Along the way, in the past few years, we have supported several of them to scale up their innovations and take them to market. And in the coming years, we will do more and more. So we'd like to work with everyone, the innovators, our judges, a panel of judges, and other partners who engage us in this innovation space. Going forward, we would work with them and ensure that the innovations that we recognize today will go to market, will get implemented, will strengthen health systems, and eventually contribute to better health gains for our populations, because our aim is just not digital health, but health for all our populations. I hope you enjoy today's award ceremony, and I look forward to meeting you again next year in a future edition of these awards. Thank you very much.
The objective of the Commonwealth Digital Health Awards is to provide a platform for digital entrepreneurs, innovators, researchers from around the world to showcase their products and solutions. The submissions were judged by a prestigious panel of judges from around the world that represented industry, academia, development partners, as well as practitioners. The following is an introduction to our eminent panel of judges. May I now invite Professor James Batchelor, the chairperson of the panel of judges, to provide an insight into the judging process.
Thank you. And good afternoon, everybody. It's very nice to be here again and participating in the 5th Commonwealth Digital Health Awards. I'm very, very lucky that I've been able to attend as a judge for a number of years now, and to have the privilege of chairing the panel of judges in what is, for me, one of my major highlights of the year, where I get an opportunity to hear about so many exciting projects that have been happening across various different countries from all over the world. And although, as Vajira said, we've unfortunately had a pandemic that stopped us being able to do this in person, the virtual judging has continued over the last 2 years, and with great success, I might add, thanks to the support of the whole team, in particular Commonwealth Digital Fellows, who some of which have passed through their internships with me here in Southampton in the UK at the university. So to give you an overview of the actual judging process, which is, as I said, probably the highlight for me, involves a group of expert panels has just been displayed to you, who come together into different groups and teams and then spend time with you, which most of you will have participated in, presenting the innovations that you've been working on, talking enthusiastically about what you've been doing, and allowing us to ask you some questions about your work and how your projects have been developed and progressed over a period of time. And as a judging panel, we spend a lot of time thinking about different categories of your innovation and scoring them accordingly, to ensure that we can represent the panel's overall scores and view of the innovation. And this is overseen by Pamela and the rest of the team, including AWS, who then help us tot up all the scores and come to the decisions that we're going to be revealing during the rest of the meeting this afternoon. So as always, there are a number of categories which we mark against, including the health need, the innovation itself, the use of different types of technology, in particular, an increase in obviously the use of things like artificial intelligence, machine learning, and various other types of new exciting technologies which can be brought to bear in developing digital platforms, including some information we've scored around about the kind of frugalness of it, the opportunity in terms of its sustainability. So there's a whole number of different categories by which we score this, score these individual presentations. So for me, it's, as I said, time for us ultimately to reveal the winners of this exciting exercise that we've been going over. And the judging was done, as many of you know, in person, well, in person via Zoom, but also offline as well for those of you who were not able to attend in person. I know every one of the judges spent a lot of time deliberating and listening and participating. So on behalf of the Commonwealth and on behalf of all of the judges, I think it would be fair to say that a great amount of thanks goes to you for submitting your particular innovations. It's obviously nice to be recognised as an expert judging panel, but actually you're the experts who've been developing these innovations. And the opportunity and the thanks from me and the rest of the judges go to you for your, as I said, time in due diligence in presenting your presentations, taking the time to explain them to us, and also answering our questions, of which most of us all had questions for you. The only shame about doing this virtually is missing the opportunity to see you all in person and to be able to talk about your innovation and see it in real life, and to spend time with you afterwards as well, following up with you. And hopefully we'll be able to do these again in person soon. But on behalf of the rest of us, as I said, thank you again for your time, and I will now hand over to our next, our guest speaker. Thank you.
Thank you. Now is the time that all of you have been eagerly waiting for. The first set of awards will be awarded for the categories of Disability Informatics, Ecotech, and Adolescent Health.
Hi, I'm Sharon. Last year, my dad suffered a stroke due to a blood clot. His doctors later diagnosed him with Wernicke's aphasia. He now has trouble understanding things I say to him. He also has trouble understanding anything he. That's when I came across Clarity Assist. Now all he has to do is tap a button on his phone and I speak into it. Clarity Assist turns what I say into text and then simplifies it in a way that my dad can understand.
Millions of people suffer from language-based disabilities around the world every day. Our mission is to help improve and maintain their quality of life. Visit www.clarityassist.org for more information.
In the beginning of 2019, and at the time I still remember visiting, to understand the market, visiting small medical facilities around Nairobi, and the quality is shockingly poor. All those facilities do not have any way to perform even a simple blood test. We built Ilara with a goal of bridging this gap in diagnostics while improving the quality of care and bringing more affordable, accessible, and accurate diagnostics here. The devices that we place are not the big, old-fashioned lab devices. They're devices which are plugged into this. The same way the laboratory machines, which used to be big, become now smaller, plugged in.
Hi, I'm Simon Carter from Jade Diabetes, a system designed firstly for my daughter's type 1 diabetes when she was 4 years old, then for my own type 1 diabetes, and then for 43,000 people around the world who are already using the platform.
Virtually instantaneously to the apps. Hey Alexa, ask my Jade to dose for 20 grams.
Have 3 units of insulin for carbs of 20 grams.
Open my Jade.
Your blood sugar at 1:54 p.m. is 5.1. Watch out for a low around 4:49 p.m.
For watching, and I'm hoping you're really excited about the future of diabetes with Jade.
This is where Cruci comes in. Cruci is a fully developed comprehensive technology that provides users with the most accurate early detection system. Cruci's system is very easy to install, easy to maintain, and efficient to the highest degree. Users just have to hammer the sensor into the tree, which listens to the weevils feeding sound within the tree. When the threat is detected, the system alerts the user about the affected tree through their mobile phone, providing the user with enough time and information to choose the most efficient, cost-effective way to save the palm tree, and prevent any additional harm to the trees around it. After the treatment is administered, the Cruci system will verify its effectiveness. Cruci is scalable to all palm species, and provides a complete 24/7 overview of your plantation condition. Not only that, the app provides visual guides for better treatment administration and lots of tips for yield maximization. Also, as an added feature, Cruci app provides a marketplace for users to sell their produce for a great price. Cruci keeps the user informed at all times and helps in yield maximization, while saving money on pesticides.
Team Sanifly from the Department of Information Technology of University of Sri Javathanapura. Sanifly is a solution consisting an IoT device, mobile application, and a cloud computing component that addresses the issues of locating and monitoring public washrooms. They address 2 SDG goals. Goal number 3, good health and well-being, and SDG 11, sustainable cities and communities. Over the world, there are a number of washroom tracking solutions available, but there is none that uses the IoT technology to provide real-time condition of the washroom without entering the area. As per the technology, we use Internet of Things, cloud technology, and machine learning technology. Speaking of commercialization, Sanifly will follow these strategies. The project has already won several awards within the university, nationally and internationally. Our ultimate goal is to take Sanifly to the world market as an international brand.
Let us start with the Disability Informatics category. And the runner-up for the category is and the winner for the category is Congratulations to the winners. May I now invite the representative from Clarity Assist to speak few words.
Good evening. Thank you to the Commonwealth Digital Health team for this awesome opportunity. And thank you to the judges for selecting us for this award. We are incredibly honored to accept it. A special thanks goes to Dylan, our product manager, and Lakshin, our tech lead, and all the developers in our team. We are hoping to launch Clarity Assist to the market soon. And I invite you all join with us and be part of our journey. Thank you.
Thank you. The next category is adolescent health. Unfortunately, no award has been won in this category. Let us now move to the category of Ecotech. The runner-up for the category Ecotech is and the winner for the category of Ecotech is Congratulations to the winners. And let me now invite a representative from Sunnyfly, the winner for the category of Ecotech, to speak a few words.
Hi, good evening, everyone. First of all, I would like to thank all the organizers for Commonwealth Digital Health Awards organizers for organizing this amazing event, as well as our greatest strength, our mentor, Professor Lasit Gunawardena, for guiding us, and also the Department of Information Technology, University of Srijawardhanapura, as well as my amazing teammates, as well as all the friends and all the people who were behind this. Thank you very much.
We have now concluded the first segment of the awards ceremony. And before we move on to the next, we would like to take a moment to reflect on the great support rendered by our partners. Our partners are our strength. They have always been with us, not only in terms of supporting the Commonwealth Digital Health Awards, but in terms of working towards a common goal in promoting digital health for health and well-being. May I now invite Andy Bladen, Communities Director of the European Connected Health Alliance, to speak a few words.
Thank you so much. And I am proud to speak here today. My name is Andy Bleaton. I work for the European Connected Health Alliance, the ECH Alliance. We are very proud to partner with the Commonwealth Centre for Digital Health for this 5th Commonwealth Awards. I'm again involved with this for the 2nd time now. We've partnered with the Commonwealth Centre for Digital Health over a number of years, and we're proud to do so. And they're also part of the Global Health Connector partnership we've built alongside the Commonwealth Centre for Digital Health. We do so because we see all of these wonderful innovations that you are going to hear from today as lots of dots. We've got a global community. Our involvement with this is because we want to be able to help spread that innovation, not just within the Commonwealth, but beyond, because we've got that ability to be able to connect up some of those dots. We use our ecosystems, which are all over the globe, some of whom have been taking part today as some of the judges. And I know some of the ecosystems have also taken part in submitting some of the awards as well. So that's a great way as well to cement that relationship. And let me talk a little bit about these awards and why we're involved with them. We see the innovation that comes from across the globe as a great opportunity to be able to say to people, here's something that has actually been judged by peers and is adoptable and scalable, not just in one country or in one region, but globally. These innovations that you're going to see today, whether it's the ones you've just experienced just now, in terms of eco awards or whatever the category might be, I get fascinated by it because I see these as great opportunities to actually say to organizations that procure, stop making excuses, start procuring these types of innovations, as these are the innovations that are going to set the future. These are going to be the innovations that have been judged by world famous people involved in the judging panels that you've seen already, but in awards that actually mean something. That the winners that I've seen in the past have gone on to see their innovations adopted at scale across the globe, and I hope to see that today. Our role in that is in some ways as an intelligence network to help expose the winners of the awards today and the runners-up as well to a wider community. So connect with us. We can help expose these awards, these fascinating sets of innovations from the Commonwealth Centre for Digital Health, because we're the global connector. We can make that connection between the awards today and the rest of our global community. I'm going to hand back to the presenters now, but I just say this one thing. Look upon today as a start of the innovation journey for many of these organisations. Many of them have been around for some time, but for many of them today is that chance when that innovation journey gets accelerated and accelerated at a pace. And hopefully today, tonight, from wherever you are across the globe, you will have that opportunity to be able to see some of those innovations, probably for the first time, and hopefully not for the last. Look upon these as a way to connect the dots as we see them within our global health community. So thank you to the Commonwealth Centre for Digital Health for including the ECH Alliance in this, and many of our members and partners too. And let's carry on with the show and see some more great innovations, many of whom I have to say I'm astounded by the simplicity and yet the impact, potential impact. Thank you very much. Let's get on with the show.
With that, we move on to the second segment of the award ceremony. This segment includes the following categories. It includes telemedicine, fintech, and nutritech. Let us now revisit the finalists in this category.
Download the Flash Help app.
Smart HIV Solution is everything you need in one single platform. It is a web-based software as a service innovation for all stakeholders in HIV disease management. Our Smart HIV Solution integrates all parties in the care of HIV patients, personalized ART, real-time communication and collaboration, HIV Smartlytics, an EMR-integrated advanced analytics and visualization platform capable of predictive analytics, evaluation and monitoring of HIV patients, and real-world evidence insight. The full capabilities of Smart HIV Solution can be harnessed with this product.
Telehealth Services by People's Primary Healthcare Initiative Balochistan in District Washuk, Tukki, Jafrabad, Mastung. Introduced telehealth services. Telehealth will provide specialist consultation including general physician, gynecologist, pediatrician, dermatologist, and will help address shortage of healthcare providers, increase access to healthcare and to specialists, enhance quality of health services, improve health outcomes, especially mother and child health services.
Arrowcare is an integrated patient-centric workflow management platform. We provide smart hospital automation component for comprehensive resource scheduling, outpatient and channeling, appointment life cycles management, end-to-end cash flow management, automated journals in one single platform. Heartbeat is a revolutionary mobile web app designed for patients to enhance digital interaction with hospital. Using Heartbeat, hospitals can uniquely brand in the digital healthcare market by enabling online patient portal with scheduling, digital payments, and home care services with real-time information.
Around the world, there's a shortage in skilled health workers, and many patients do not have access to a medical doctor or needed specialty. As a solution to this problem, the Otis Clinic has developed a way to use telemedicine technology to connect remote and underserved patients with the essential care. The frontline health worker begins by conducting a physical exam of the patient, gathering information on the patient's symptoms, medical history, current medications, and relevant tests. Using the Collegium Telemedicus platform on a phone or tablet, the health worker uploads information collected during the physical assessment to determine the most appropriate diagnosis and treatment plan. Our innovative use of telemedicine has the ability to overcome geographical barriers to care and to improve the quality of healthcare in the developing.
Helios P2P is Sri Lanka's first peer-to-peer lending platform.
At Helios P2P, our
value proposition to our customers is, in terms of borrowers and lenders, you can get the most equitable and attractive interest rates out there compared to what you could get from alternative platforms. So Helios P2P is basically a platform for a two-sided market. We connect lenders together with borrowers. So lenders, when they sign up, they have it's pretty easy for them. They can just sign up by providing a few details. For borrowers, however, it's slightly more rigorous, as we have to do know your customer checks as well as do a credit rating, where we grade them according to different risk ratings depending on their capacity to pay, as well as their credit history. So based on that, basically they can just sign up at www.heliosp2p.com. Borrowers can provide the necessary documentation.
Hello everyone, my company Commonwealth is developing a buy now pay later service for healthcare services to help patients pay their out-of-pocket expenses with maximum of 6 months return policy without any interest rate or late fee. We are initially targeting a market of $6 billion, from where we will make money through merchant discount rate, transaction fees and advertisements. We are initially targeting services for the customers in B2B area. We will be providing our service to the corporate office employees as their health benefit service. Our team initially have a total experience of 3 years in financial market.
What you want, anywhere. Well, just visit myherbals.lk. Just go to our website, select what you want, and click buy. It's easy as that. myherbals.lk. Make your herbal choice online today.
Malnutrition is often a misunderstood term that doesn't do justice to the reality of its impact or the horror of its effects on children. Our solution, called Monitor T, showcases how relatively simple digitalization of this manual process can save millions of lives. Systemic intervention might be needed. There are 4 main advantages to our solution. The most important one is the increased certainty of measurement. Secondly, traceability in the process entails the unambiguous identification of both the child and the clinical staff. We tested the technology with a group of nurses in both public and private service. We saw an 80% reduction in time spent on measuring in the world that we help create through Monitor T. We hope that malnutrition will be better managed and understood. And we believe that in this process, we will be one step closer to achieving UNICEF's vision of a world where children will not only survive, but thrive.
Category Telemedicine. The runner-up of the category Telemedicine is and the winner for the category Telemedicine is Congratulations to the winners. I would like to invite a representative from the Syscom clinic, the winner of the category Telemedicine, to speak a few words.
I'm overwhelmed and excited. Thank you so much. We have been working with this project since many years, and we are providing health care services to the underprivileged countries, to the underprivileged of our country, and I'm really excited. This is a teamwork of my management, my team of doctors, and my paramedical staff who are working in the far-flung areas of best healthcare services to the underprivileged.
With that, we move on to the category of fintech. Unfortunately, a runner-up or a winner has not been chosen in this category. However, the panel of judges has decided to award a jury special mention, and the jury special mention goes to Congratulations to all DOC on winning the jury special mention. Next up is the category of Nutritech. In this category, we only have a winner. And the award for the winner of the category Nutritech goes to Congratulations to Team Monitor T. A representative from the winning team may now speak a few words.
Good afternoon, everyone. I'm overjoyed, and it is my great pleasure to receive this prestigious award on behalf of myself and my team at the Northwest University in Potchefstroom, South Africa. I wish to thank the organizers and the judges for their time and for this inspirational event. It is really an honor to be associated with your institution.
That brings us to the end of the second segment of the award ceremony. Wishing the finalists in that segment all the very best in their future endeavors. When it comes to Commonwealth Digital Health Awards, Health Informatics Society of Sri Lanka has been a pillar of strength. Not only HISL has operationalized the event, but it has also contributed in wider digital health initiatives of the Commonwealth Center for Digital Health. I would now like to invite President of the HISL, Professor Rohana Marasinghe, to address the gathering.
Thank you for welcoming me. As the President of the Health Informatics Society Ceremony 2022 today, it is my pleasure to say a few words of the Health Informatics Society of Sri Lanka, and then brief the link between the Commonwealth Center for Digital Health and with the Digital Health Award ceremony. The HISL, Health Informatics Society of Sri Lanka, was a bit of all, more than 25 years organization. In, of course, 1999, the HISL was registered as a non-profit organization in Sri Lanka with the aim of bringing healthcare workers and ICT experts into the single platform. To date, The HISL has come a long way and would like to showcase few activities which has paved a way to link the global communities such as the Commonwealth Center for Digital Health. One noteworthy achievement is the development of high-quality human resources in digital health. To do so, we have collaborated with various organizations such as the PGIM, Postgraduate Institute of Medicine, which is the main body who train postgraduate medical doctors in Sri Lanka, and of course, with the Ministry of Health in Sri Lanka, who funds and employs such doctors in the government healthcare institutes. We introduced PG degree programs, MSc in biomedical informatics, leading to MD in health informatics. And we are proud to say that the first batch of consultants in health informatics are now being employed in the Ministry of Health in Sri Lanka. The other important area is the research. Of course, this was well linked with the needed projects in Sri Lanka, started as MSc research projects, now developed to the extent at which some projects are integrated into Ministry of Health as a way of care provisions. Obviously, such projects need funding. For the funding, we are collaborating with both national as well as international organizations such as World Health Organization, Norwegian funding agencies, and so on. The link between HISL and with the Commonwealth Center for Digital Health is pretty obvious. You could see that almost all the members who are active in Commonwealth Center for Digital Health from Sri Lanka are the members of the HISL. My dear friends, such a strong link is kind of a powerhouse, which is evident in today's ceremony. Therefore, I'm delighted of the contributions secured by the Health Informatics Society of Sri Lanka to continue as a global event. Today, it is the 5th event, and I'm happy to say that the HISL would like to convey well wishes for the contestants and congratulations for the winners. I thank you.
It is with pleasure that I introduce the chief guest of the 5th Commonwealth Digital Health Awards, Dr. Osuhon Enabulele, President of the Commonwealth Medical Association, President-elect of the World Medical Association, and the coordinator of the Coalition of African National Medical Associations.
Good afternoon, everyone. I hope you are hearing me loud and clear. I want to say that it's with immense pleasure that I address you today. First, I want to recognize all the protocols. I recognize the leadership of the Commonwealth Digital Health Center, which of course is doing an amazing work. I recognize my predecessor in office, Professor Vajira Tisanayake, who is doing so well to organize this. And so I recognize all other established protocols. And I would like to proceed to speak to this distinguished audience today. First is to say that it is with utmost humility that I speak to you today at this 5th edition of the Commonwealth Digital Health Awards, organized by the Commonwealth Digital Health Center. I want to extend to Professor Vajira Disanayake-led leadership of the Commonwealth Digital Health Center and all members of the center my very warm felicitations. I'm quite proud of the strides made by the center since it was vetted a little over 3 years ago during its tenure as president of the Commonwealth Medical Association. I equally want to appreciate the roles the center continues to play in the strengthening of digital health and its application in healthcare systems, including the management of the ravaging scourge of the COVID-19 pandemic, which has undoubtedly devastated lives and livelihood, worsened health disparities and inequities, and poses a great challenge, and has posed a great challenge to healthcare systems with tremendous impact on physicians and other health professionals, some of whom very sadly pay the supreme price in the course of duty. And I want to say that may the great souls of our departed colleagues rest in perfect peace. As you may know, this is my very first invitation extended to me by the center, and is also my very first address to the center since my election as president of the Commonwealth Medical Association on November 5, 2019. I therefore thank you for the privileged invitation, and I commend the organization of the annual Digital Health Awards, which I believe is aimed at recognizing innovations in digital health technology for the advancement of digital health and health systems. This is even more important now, with the experience of the COVID-19 pandemic, which has unearthed some challenges and learning opportunities, including the critical role of digital health in this era. I wish to therefore heartily congratulate all the award winners and urge them to see their well-deserved awards as an added spark to ignite further digital health innovations and development of tools for advancing healthcare systems and the attainment of universal health coverage. As we seek to advance digital technology and digital health, I urge that we pay due attention to the need for regular conduct of quality and performance audits with strict adherence to ethical requirements and expectations. I equally urge that we pay due attention to the peculiar and varied socioeconomic, infrastructural, and cultural challenges faced by various countries of the Commonwealth, particularly the low and middle income countries. The unfortunate display of vaccine nationalism and stockpiling of COVID-19 vaccines by countries of the global north, especially during the early phase of COVID-19 vaccine production, contributed largely to vaccine inequity, evident in the fact that over 40% of citizens of the Commonwealth and about 90% of the African population are yet to receive primary vaccination. We must therefore deploy digital technology and digital health towards achieving a more equitable world and healthcare system. As we celebrate today, at this 5th edition of the Commonwealth Digital Health Awards, may I inform this distinguished audience that the Commonwealth Medical Association shall later this year organize a maiden CMA Healthcare Excellence Award event. This is part of our efforts to strengthen health systems in the Commonwealth of Nations through promotion of excellence and motivation of the human resource for health and other critical stakeholders. This event is planned to hold in Nigeria later this year. The call for nominations ended on May 31st, 2022. During this event, several health professionals, health workers, health administrators, and citizens in the Commonwealth of Nations will be recognized and honored for their commitment to the advancement of health systems. I therefore want to solicit your support for this initiative and invite you to participate at this event. Finally, I wish to assure you of my sustained solidarity and support and that of the Commonwealth Medical Association as the center projects its objectives and programs. I wish you a very successful 5th Commonwealth Digital Health Awards. Thank you for your attention. God bless you.
Which brings us to the third segment of the awards ceremony. The categories included in this session are telecare, emergency informatics, health education, and health promotion. Before we announce the winners, let us view the finalists of these categories.
solution is to building a management system where it is possible to keep track of who gives the blood, where the blood is stored, and who is the seeker of the blood. Only using a token, people from all walks of life can get blood easily for free. They will have not to face any hassle to manage the right amount of blood at the right time. We developed a website where all the data will be stored in blockchain. To be part of this community, you must first register and log in. After successfully logging in, your wallet will be opened. Here, you will be given your wallet ID and your saved token number through blood donation. You can easily collect blood through your token when you need blood, and also you can transfer tokens to your relatives or friends at any time. We hope by our smart blood bank we will be able to save more humans.
IU is launched to empower health prescriptions to deliver patient care fairly and efficiently with the cheaper cost. With the use of this IU app, you can find fast response time, great doctors, health consultation in a few taps, optimized client scheduling, better pricing, and maintaining records. Patient can search specialists, view profiles and availability, and select available time slots. And also, the medicines are delivered to the patient's house from a nearby pharmacy on the same day with use of GPS tracking. Doctors can see their schedules and appointment easily. IU allows patients to attend live webinars conducted by health experts.
Doc 990 automates medical appointments at Lady Ridgeway Hospital to bring convenience and ease to patients from all over the country. Prior to the launch of Doc 990 clinic management solution, people from all over the country were required to visit the hospital and wait in long queues for hours to book their next clinic appointment. Completely revamping the hospital's processes, the Doc 990 clinic management solution now enables staff to manage doctor-patient appointments via a digitized system, making for a convenient doctor channeling experience for both patients and the hospital's staff. With this channeling platform, patients from across the country can now dial its toll-free trilingual hotline 1390 to place direct appointments with specialist doctors at any Lady Ridgeway Hospital.
Inpatient days calculated is based on patient admission and discharge dates. The blue lines depict patient stays in days and the yellow is the time frame. This is the workflow for Midnight Report. This is the TID calculator. First you give admission and discharge days and ward numbers, then give the time frame. The total inpatient days and relevant indicators are automatically calculated.
In medicine, talking about clinical cases is at the heart of how doctors learn. From medical students to specialists, case discussion is an essential way to share knowledge and skills. MedShare enables doctors to discuss cases and connect in a global community of medical professionals, helping each other to learn and grow and to improve patient care. The MedShare app allows doctors to use their smartphones safely and securely with patient consent and the latest cloud technology. The app is designed to be quick and easy to use so that it can be part of your everyday clinical. MedShare is a global community of medical practitioners that connects you with professionals around the world.
This is Inhaler, world's first earbud that detects breathing. Let me give you a quick demonstration on how this works. Let's look at the enclosure first. This earbud is created perfectly to fit into your ear so that it would not fall off when you move around actively. Furthermore, this enclosure covers the PCB of the device.
Category Telecare. And the winners are Congratulations to the joint winners. I would now like to invite a representative from Doc 990 Clinic Solution to speak a few words.
Hello, very good evening to all of you. So on behalf of my company, Digital Health Private Limited, I take this opportunity to express our sincere gratitude to Commonwealth Digital Health Awards Committee, our panel of judges, program coordinators, and everyone who assisted us from the very beginning itself. So with great honor, we truly value the recognition and appreciation provided for digital healthcare service Doc 990. So we will continue to serve our country by uplifting the healthcare services by introducing frugal, innovative, scalable products which will reach out to masses, enabling us to connect digital healthcare ecosystem without any barrier. Thank you very much.
Thank you. Can we now have a representative from I Will Care to speak a few words?
Thank you so much, Common Digital Health Awards, for this recognition. It means a lot for the team. I have been fortunate enough, every discussion that I've had with the panel of judges has been insightful. Even the questions that were asked helped me and my team to make the product better. The idea is that anyone who needs mental health care should have it. And I really urge and vouch that I and my team will continue to do the best, but we will need your support here at Common Digital Health Awards and the partners to help us scale this so that anyone who has any mental health issue finds care, recovery, and a good life and a quality of life. Thank you.
Category Emergency Informatics. Unfortunately, a winner has not been declared in this category. However, the jury has decided to award a special mention in this category. And the jury special mention goes to Congratulations to Team Digital Emergency for winning the jury special mention. The next category is health education and health promotion, and there is only a winner in this category. The award for the winner in the category health education and health promotion goes to Congratulations to the team Reach 52 Campaign Builder. Can we have a representative from Reach 52 Campaign Builder team to speak a few words to the gathering? That brings us to the end of the third session of the award ceremony. In our journey, BMJ is a name that has been inseparable. For the 5th Commonwealth Digital Health Awards, the Commonwealth Centre for Digital Health partnered with BMJ Innovations, a BMJ journal covering research on emerging digital health, medical devices, and innovations. It is with pleasure that I invite Dr. Ashley McKim, Editor-in-Chief, BMJ Innovations, and the Director Partnerships for BMJ to say a few words.
Thank you, and it's a real pleasure to be invited to be involved in these awards again. And on behalf of BMJ and myself, I want to say a huge thank you to the organisation for inviting us to judge again this year. And congratulations to all the winners and entrants. As always, the standard of the entries has been fantastic, and we've seen really great innovations there as well. The last 2 years of COVID have really been something that none of us expected, and some of the toughest times that we faced in healthcare. And despite the huge amount of mortality that COVID brings, global disasters in this scale tend to bring a huge imperative for innovation. Unlike past pandemics, we're likely to see some of the innovations that happened during the last 2 years have a lasting impact after we've got COVID under control. And I think many of the entrants that we've seen this year in the awards are some things that we hope will go on and make lasting impact on patient outcomes going forward. Ever since that first pandemic back in 500 AD, almost all have precipitated that stepwise move forward in healthcare. The cholera pandemic of the mid-1800s gave us the birthplace of epidemiology. The Spanish flu gave us our focus in public health, and the birthplace of the Bureau for Fighting Epidemics, which was formed in Vienna, which was the precursor to WHO. Looking back in COVID, it's likely we'll see this as the digital health pandemic. COVID was the first where we saw the rapid deployment of technology, and specifically digital health technology, in the race to understand, to track and deliver a solution. And we saw these paradigm shifts in how we develop vaccines that we thought would take, usually a decade, brought down to a couple of years, and lots of use of technology about predicting transfer and movement of COVID around the world. Some of the entrants that we've seen today and we've seen over the judging periods really showcase some of that innovation and that role of digital health in driving healthcare improvement. And we hope over the next decade that we'll see many of those make tangible improvements in health outcomes. But as some of the other speakers said, the work doesn't stop there. For our winners today, for our entrants today, there's an obligation, a requirement now to go on and spread those great innovations around the world and make a real difference to patient outcomes. And we hope at BMJ that we'll see over time many of those innovations published either as early stage innovation reports, which is a new type of paper we've got in BMJ Innovation, or a formal research paper as well. So again, for myself and BMJ, a huge congratulations to all the winners and entrants, and we look forward to see how your innovations make a real difference to patients.
Thank you, Dr. Ashley McKim. Which brings us to the penultimate session of the award ceremony. The categories included in this session are communicable diseases, non-communicable diseases, maternal and neonatal health, and EdTech. Before we go on to the award ceremony, let us first revisit the finalists of these categories.
Hayat is an innovative, robust mHealth solution which aims to empower frontline health workers with mobile technologies in efforts to increase coverage of and access to routine immunization, maternal, newborn, and child health care, and child growth and illness services in target areas of implementation. Hayat consists of a mobile application for frontline health workers and supervisors and a web portal for government administrators. It contains the following modules. The Hayat mobile application is for use specifically by frontline health workers, including vaccinators, lady health workers, and lady health visitors in Pakistan, and community midwives, community health workers, and vaccinators in Afghanistan. The app helps digitize the paper-based forms for vaccination and maternal care services provided and allows health workers to raise awareness in community.
Hi friends, my name is Dr. Ashfaq. I work with Norway-India Partnership Initiative. Under the Astana Declaration for Strengthening of Primary Health Care, Government of India has introduced the Ayushman Bharat. Under this Ayushman Bharat scheme, health and wellness centers are envisaged to provide primary healthcare facilities. These primary healthcare facilities are being manned by community health officers. The problem, however, is that they are new to their role. They have very limited capacity for decision making and may not be able to practice evidence-based care. To address this issue, Norway-India Partnership Initiative, with support from the national health missions of the 3 states, introduced an innovative client-centric decision support tool that will help in identification of severity.
The NCD's 365 app provides users with a platform to learn about all the 5 major NCDs. Through the app, the users are also able to learn about how to prevent NCDs, including practical nutritional advice.
Basically, Telescreen is a thalassemia screening device powered by artificial intelligence-based decision support system. It has Internet of Things enabled hardware and a cloud-based application. What this means is that the device will perform the test and automatically interpret the results and then send them to an expert pathologist who can verify the results without being physically present in the lab.
Do you know that type 2 diabetes and hypertension are the outcome of long progression of metabolic changes? Do you know that blood glucose level is not 100% sufficient to identify someone's risk of developing these conditions? Do you know that being pre-diabetic isn't just a warning, but without significant changes to dietary and lifestyle habits, you are actively developing vascular dysfunction? Our solution, IHRA, identifies these vascular changes earlier than glucose levels. and shows your risk of developing type 2 diabetes and hypertension.
At Nutromics, we have a vision to create a world with zero preventable deaths through timely and personalized molecular data. We'll achieve this through our wearable sensors. Join us.
At Diabifly, we go beyond the generic health advice and suggest PGR-backed lifestyle changes that are more personalized and work according to your body. We do this using a CGMS device and our advanced algorithms. A CGMS device is a small patch that attaches to your arm and painlessly takes blood sugar readings every 15 minutes for 14 days. These readings give a look at how the blood sugar levels vary for you throughout the day. Using our algorithms, we correlate the rise and fall of blood sugar levels with your food habits, exercise routine, and lifestyle in general. This helps you understand your personalized glycemic response and identify which foods and everyday habits are good for your health and which are not. You can then make more informed lifestyle choices based on what works best for your body. Enroll for the Diabifly Pro program for type 2 diabetes.
2018 guidelines recommends the use of informational technologies in the scale-up of antiretroviral therapy. ArtAccess is a web-based application that links patient health information such as viral loads, their HIV treatment regimen, and streamlines art delivery to private pharmacies in Kampala.
Recently, I lost a family member to breast cancer, and I know that as a woman, breast cancer is something that I have to keep checking myself for. Unfortunately, there's no way that is safe, reliable, and easy to find out about malignancy. While doing a lot of research and discussing this issue with my friends, one of them suggested the Niramai technology to me. Having heard about it, I went to get a checkup done. I was quite skeptical before I went for the test. It took me by surprise because the machines didn't touch me. It was all happening from far away. जैसे eye test होते हैं ना, दूर से बिल्कुल वैसा.
Mdoc is a digital health company based in Lagos, Nigeria that provides virtual self-care support to people living with regular and chronic health conditions. To date, we have over 71,000 members on Complete Health, our digital health platform. And about 85% of these members are women of reproductive age. Through our work with these women, we have recorded over 51,000 maternal lives saved. Mdoc continues to improve the narrative of quality healthcare delivery in underserved populations in Africa.
First fast, you know how you're ready. You have to go back and go for food. You are doing how food is artificial.
ගෞරවනීය මාතෘ සේවය අභිමානය සුරකින අන්දමේ සේවය සේවය සැපීමට පෙර අවසර ගැනීම රහස්‍යභාවය ආරක්ෂා කිරීම
මන් දැන් අම්මගේ යටින් අත දාලා බැලුවා ගැබ් ගෙල කොච්චරක් ඇරිලාද කියලා.
මෙතන තිරයක්වත් නෑ. ඩොක්ටර් කියන හැමදේම එහා පැත්තේ ඉන්න අම්මට ඇහෙයි. නේ මට හරි ලැජ්ජයි. අනේ මට මේක ඩොක්ටර්ට කියන්න පුළුවන්.
Standalone 5G network in the United Kingdom. So this virtual reality has been in use for years, decades even. But the 5G edition allows for a completely seamless, low latency, highly immersive learning experience for our students.
And because the possibilities for learning that it brings with clinical degrees like mine.
We could see all different parts of the human body without actually having to be there.
This technology has amazing potential. So this is just the first step on what we hope is a very long and very exciting journey.
Exchange algorithm can be used in a variety of scenarios as shown above. You can have a variety of unique identifiers too. Taking the letters of English alphabet as the unique identifiers, I will show you how the algorithm works on a spreadsheet.
Is a 24/7 on-demand learning resource sharing platform, which enables organizations to upload, manage, and customize learning content for different user groups with ease. You can personalize content for every individual. Allows you to upload and share unlimited videos easily with a few clicks of the button and design how the user interacts with it. We have Reels for documents as well to support any learning need, create and track simple in-video e-assessments, and also tag assessments to relevant videos.
We are Shield Technologies, who develop eVidwala.lk. So what is this eVidwala? It is the application which will be available for all students and all students who have been affected with the pandemic. So when the pandemic...
Home screen for the student application. So you can see there are a lot of varieties of the subjects that London A-levels, London Honours, grade 10 to 11 A-level classes. So once you go inside that, if the teachers are available, you can see there will be the teachers. So yeah, these are the teachers. So we have already.
Sri Lanka has achieved immense success in universal healthcare coverage over decades, with the commitment of all the healthcare staff. Family Health Bureau, as the national focal point of the maternal and child health, provides guidance through training to public health and curative health staff to keep their knowledge up to date, despite many challenges. As a timely and modern intervention to overcome these challenges, Family Health Bureau has developed a bridge, the online training platform in view of catering the staff even in difficult terrains.
So hello everybody, my name is Jay Shapiro. I'm the founder and CEO of Usiku Games, based here in Nairobi, Kenya. We are fundamentally a gaming for good company doing social impact games. There's a problem that exists today where the youth around the world, but certainly in Africa, are largely deaf or don't hear it at all. However, if that messaging comes through hip hop, comic books, or video broccoli in a chocolate bar, 99% of them will choose the chocolate bar. And if I were to run an engine of serious games designed first to be fun, but with a very conscious educational and behavioral change objectives that we then tie into. We created a game earlier this year with GIZ from Germany that is tied in with the Google Fit API, where the only way in the game to increase your strength and skills in the game.
Category: Communicable Diseases. Unfortunately, the panel of judges has not awarded any awards in this category. However, we take a moment to congratulate all the finalists and wish them well in their future endeavors. Next up is probably one of the most popular categories in the Commonwealth Digital Health Awards. Therefore, the panel of judges has awarded winner, runner-up, as well as a jury special mention in this category. The categories: neonatal and maternal health. First of all, the jury special mention. The jury special mention goes to and the winners are Congratulations to the joint winners. I would now like to invite a member from the team Hyatt Mobile Applications to address the gathering.
Hello, thank you so much. I'd like to thank everyone, the organizers, the judges, on behalf of our entire team at the Aga Khan University. It's honestly such an honor to be selected amongst this amazing cohort. And I think Hayat is just a testament to what we can achieve through cross collaboration and just a strong commitment to providing evidence-based care and just reaching the hard to reach, no matter how difficult it seems. Thank you again.
Thank you. May we now have someone from Decision Support System to speak a few words.
Hi, everybody. Thank you, organizers and the jury, for nominating us and selecting us. And I would like to thank the National Health Mission of the states that we have been working. And I would also like to thank my team, which has been working tirelessly to ensure that a desired outcome of a decision support system is achieved. Thank you once again.
The next up is also a popular category in the Commonwealth Digital Health Awards. The category is non-communicable diseases. In this category as well, the panel of judges have awarded a jury special mention, runners-up, as well as a winner. Let us now look at the winners. The jury special mention goes to The runner-up of the non-communicable category is And yet again, we have joint winners in this category. The winners are Congratulations to the joint winners. I would like to invite someone from the team Intelligent Health Risk Assessment to speak a few words. Thank you. Can we now have a representative from Nirmai Thermalytics to speak few words?
Sure. Hi, I'm Geeta, founder and CEO of Niramai. I'm extremely delighted to receive this Global Commonwealth Digital Health Award on behalf of Niramai Health Analytics. We are from India. We thank the organizing committee for creating this wonderful platform to showcase the health tech innovation and the expert jury for recognizing the importance of our automated, affordable, accessible, non-invasive, privacy-aware method of screening for breast cancer. Thank you very much. All the credits of this award goes to our passionate Niramai team who are consistently and persistently and tirelessly trying to solve this problem since 6 years. We thank our mentors, investors, and well-wishers for supporting us throughout the journey. Breast cancer is curable. Let's all work together to stop untimely deaths of women due to breast cancer. Thank you very much.
Category EdTech. The runners-up for the category EdTech is and the winners for the category EdTech is Congratulations to the winners. Let me now invite a representative from Visis by Winsight to speak a few words.
Hi, everyone. My name is Tommy Kolaole, and I'm from Vinsight. We're super excited to be awarded this prize, this honor. And we're really grateful. And we are are so much excited because it's an important thing to drive inclusive education, especially for those with disabilities across Africa and across the world. And we are glad that the Commonwealth Digital Health Awards is supporting this project of ours and also supporting inclusion across the world. Thank you very much.
This year, we also partnered with the Information and Communication Technology Agency of Sri Lanka, better known as ICTA Sri Lanka. ICTA is the lead agency in Sri Lanka for implementation of information and communication technology initiatives by the government of Sri Lanka and plays a crucial role in startup ecosystems. May I now invite Mr. Sachindra Samararatna, Director, Startup Ecosystems, ICTA Sri Lanka, to speak a few words.
Good evening, ladies and gentlemen. I first should thank Dr. Pandula and Tony especially for inviting me and therefore ICTA at the onset of our discussions in getting the pathway ready for the Commonwealth Digital Health Awards. So we are very grateful to be a part of this. And it has been a learning experience for us as well. So as ICTA introduction was mentioned, we are the apex body for technology in Sri Lanka, especially in the digital transformation space. But our main role for this Digital Common Health Awards was because of the work that was done in the startup space. So I thought it will be opportune to address the entrepreneurs and the startup founders on this particular day, on this who have won and who have competed. The dividends of the digital economy will only go to the common man if solutions are built. And these solutions are the vehicle that the common man are able to use and to have a better life. And because of that, the innovators out there, all of you who have taken part in this Commonwealth Digital Health Awards are all winners. And it's great to see the feedback and how you responded to the feedback that was given by judges. Being part of the startup ecosystem for the past 12 years, I've seen a lot of pitchers, been through many incubation rounds, and even the last 2 days have been part of our own spiralation program, listening to 48 pitchers. It's very inspiring to see at a time that we are looking for little bits of hope in our country. It's very inspiring to see that 86 people applied for spiralation and listening to see 43 people pitch. It's inspiring to see so many of you who have applied and have pitched to the Digital Health Awards as well. And I think across the world, when there is less hope of the future, without running away from it, you guys who are the innovators and the startup founders have become the solution without going and looking for the solution elsewhere. And I congratulate you all. As a startup ecosystem in Sri Lanka, I would like to invite those who pitched in this particular competition, who presented, to work with ICTA so that we can help you to take part, to go forward in your entrepreneurial journey. Let this innovation and this prize itself not stop you from getting to the next step. And something that I really like about the Digital Health Awards is that an accelerator is linked to it. And that will help you with further mentoring to seek your potential in the world. By listening to most of the pitchers in this competition, there are so many common solutions through partnerships that can be taken all over the world. And something that Simon Sinek says is to understand your why. And I believe those founders who pitched for this particular awards have understood their why and will do whatever it takes to take the benefits of your solution to the entire world. And I wish you all the best for that. And ending on a note, for especially the Sri Lankan founders and entrepreneurs on this call, you can connect with ICTA, you can be part of the 10,000 Ideas program. And as you know, one of the important ways of getting out of the economic situation that we are all in is through entrepreneurship, is through creating employment, is through connecting your solutions with the global requirements, understanding the problems, validating it, and then pivoting if required through the feedback that was received by the eminent panel and taking it out there so that you will solve the problem. I would highlight the fact that pivoting or changing your solution to fit the problem is not a failure. It's the point of success where you're able to create that impact. And therefore, once again, I would like to congratulate all of you who participated and especially the winners. When you win, there is a much bigger responsibility on you because the entire judging panel have put that responsibility on you to somehow take it forward because of that credibility that the point system that has given you. So therefore, wish you all the best in that as well. And an ICTA would like to once again thank the organizers of the Commonwealth Digital Health Awards. And we plan to be part of the acceleration process in the looking at the next steps to come as well. And would like to collaborate in these domains to further entrepreneurship in the world and the entrepreneurship ecosystem in Sri Lanka. Thank you once again.
In recognition of the many innovations that came up during the COVID-19 pandemic, the panel of judges decided to open a new category for COVID-19 related digital innovations. And as expected, it proved to be a very popular category. And before we go on to the winners, let us see the finalists in this category.
COVID-19 Smart Vaccine Certificate. The Smart Vaccine Certificate is the most convenient and efficient way of providing proof of vaccination required for overseas travel. ICTA, the Ministry of Health and health experts got together to develop a system that offered a solution for those who needed to travel overseas during the pandemic. What's unique in the Sri Lanka Smart Vaccine Certificate is that it's easy to obtain and offered free of charge to all Sri Lankans. You can save the vaccine certificate on a mobile device or even print it. It's safe and reliable. It's accessible island-wide. No more queuing, which significantly reduces the risk of COVID-19 transmission. Sri Lanka Smart Vaccine Certificate, the most convenient and efficient way of providing your proof of vaccination.
Introducing a global pandemic population health data analytics platform for health planners, policymakers, researchers, and consumers, which can use data at the whole of the world, at a country level, groups across the world, countries, groups of countries, alliances, or even groups of organizations, such as cancer alliances. Here we use 6 data sets to create a story. Fukushima, Hurricane Katrina.
Communication programs. I'm joined by my colleague, Dominic Shattuck. Today, we're going to present the COVID behaviors dashboard. This dashboard visualizes data from the COVID-19 Trends and Impact Survey with demographic breakdowns where applicable. You can see an animation of one of the visuals here to the right. To date, 34 million, and what is shared with Facebook or Meta, who is the funder of the Data Gap, a survey on COVID prevention behaviors and vaccine intent. The gap that this survey fills cannot be underestimated.
Over the last 2 years, Call for Life COVID, a web-based interactive voice response system, has been used for the monitoring of COVID-19 patients and suspects in Uganda. With this system in place, there's a decreased need for resources such as staff, time, fuel, that came with physical visits to the respective households. What is most interesting about Call for Life is that it is easily adaptable, and we are currently exploring its use in other outbreaks such as Ebola.
Tamanu is a patient-level electronic medical record. So essentially it covers an individual's clinical record from the beginning of their life until the end of their life. Tamanu is a digital system and they may not always have a stable internet connection.
At the moment, Tamanu is being used in 6 countries across the Western Pacific, including Samoa, Fiji and Nauru. In Samoa, Tamanu has been integral to the national COVID-19 vaccine rollout and has been used to record vaccines for more than 80% of the population.
The best thing about working with Beyond Essential Systems and Tamanu itself is that you're just able to see real results in the project that we work in. I think we just deliver something that's quite real and you can see the benefits that it's having already.
COVID-19 immunization tracker was developed and implemented throughout the country to support Sri Lankan health authorities' battle against COVID-19. It enabled monitoring local to national level vaccination status through dashboards and data analytic tools. CIT is a complete ecosystem for managing COVID-19 vaccination data, consisting of
My name is Professor Leanta Grobler. I'm the founder and CEO of MediHive, which is a spin-out company of the Northwest University in South Africa. And we bring expert healthcare services to your doorstep. My slides don't want to move. Like this. Oh, there we go. So when COVID-19 struck, newspapers all over the world flooded us with the news of a critical ventilator shortage. But do you realize that there was a crisis behind this crisis? Our solution is a low-cost, high-impact digital system that enables remote patient care and decision support for ventilated patients, both in hospitals and at home. And we can, by doing this, protect the nurses and increase their capacity. And our universal remote condition monitoring solution for ventilators comprises everything indicated in teal in the bottom right-hand corner, while it also perform digital triage once trained to reduce the sensory overload of the ICU staff.
Vaccine certificate verification. After the global spread of coronavirus, many companies made different kinds of vaccines. Every country's government made this mandatory for their people to get vaccinated. In this case, a vaccinated person needs to carry his or her vaccine certificate. But sometimes people make fake certificates. And also some developed country does not allow all kinds of vaccines. For this purpose, people change their vaccine status in an illegal way, which is a great security risk for many countries. To solve this problem, we made a supply chain and a certificate authentication based blockchain system. In this system, all the data of vaccinated people will store on blockchain so that verification will be much faster and more accurate. Due to blockchain's immutable nature, no one can generate or fake certificate or manipulate the data.
Mental health care and well-being platform for educating people about mental health care, building awareness and offering professional counseling services based in Bangladesh. We are working towards SDG and 5. Our mission is to make mental health services accessible and affordable and convenient for everyone. Monirpol designed one-stop COVID-19 support platform, which offered holistic support to fight back against the pandemic.
වලට හඳුන්වලා දීපු features දෙකක් තියෙනවා. එකක් තමයි individual test reports issue කරන එක. අනිත් එක තමයි quarantine certificates issue කරන filter එක. date එක අපි select කරගත්තම end date එක select කරගන්න තියෙනවා. ඊට පස්සේ ordering category එක මොකක්ද කියලා select කරලා test as individual report කියලා එකක්. අන්න ඒ button එක click කරා. එතකොට මෙන්න මේ එන්නේ අපිට ඒ patient අදාළව individual report එක. මුලින්ම අපි
present about Super Rickshaw, LIMS for COVID-19. Also, Super Rickshaw online lab information management. So what we did here, first of all, we introduced a mobile app. So over here, we have digitalized the paper-based format to the computer-based format. And we gave a mobile app to the Play Store.
And now for the winners of the category COVID Tech. The jury special mention goes to and the runner-up of the COVID Tech category goes to And we have joint winners yet again. And the winners of this category are Congratulations to the joint winners. I would now like to invite a representative from Team One Step COVID-19 Support Platform to speak a few words.
Thank you so much. We're so happy and glad. And I think I don't have any words. Thank you so much, everyone. Thank you. Hello? Am I audible?
Thank you. I would now like to invite a representative from the team Tamanu to speak a few words.
Hello, hi, sorry, you'll have to forgive me. I'm without video today. I'm currently in the highlands in Papua New Guinea. But yeah, thank you so much for this amazing award. It's an incredible honour, and a big thanks to the team behind Tamanu as well, who have worked tirelessly throughout COVID to make an incredible solution that we've been able to implement in a number of different countries. So thank you very much.
That brings us to the end of the final session of the award ceremony. Let me now call upon Dr. Pandula Siribaddana to deliver the vote of thanks.
Hello, everyone. I'm indeed honored to deliver the vote of thanks as the convener of the Commonwealth Digital Health Awards on behalf of the Commonwealth Centre for Digital Health. As you know, Commonwealth Digital Health Awards started in 2016, and this is its 5th iteration. During the past 6 years, we have achieved many feats. However, we do not consider this iteration to be the end. 5th Commonwealth Digital Health Awards is another milestone and perhaps an event that stood the test of crisis. It is an example of what goodwill and partnership can achieve, an achievement that may help transform many lives across the globe. As the convener of the Commonwealth Digital Health Awards, I take this opportunity to thank all those who contributed in making this event a success. Firstly, I would like to thank Dr. Osahan Enabulele, President of the Commonwealth Medical Association, President-elect of the World Medical Association, and the coordinator of the Coalition of African National Medical Associations for accepting our invitation and being with us as the chief guest. CWCDH and the Commonwealth Digital Health Awards have its roots with the Commonwealth Medical Association, and therefore your presence symbolizes the strong ties that remains between the Commonwealth Center for Digital Health and the CMA. Thank you very much. I would next like to thank the wonderful panel of judges led by Professor James Batchelor, who dedicated many hours in the process of screening and identifying this year's winners by meticulously preparing score sheets based on the presentations made, as well as the information shared by the applicants. We had more than 35 judges for this year's, representing many sectors related to digital health and from many countries. We take this opportunity to thank you and also to request your continued support as we journey with our innovators in the future. As I said earlier, Commonwealth Digital Health Awards is a product of goodwill and partnership. Our partners have contributed immensely to our success. I would like to take this opportunity to thank our partners, the European Connected Health Alliance, BMJ Innovations, Analogy Partners, Information and Communication Technology Agency of Sri Lanka, Health Informatics Society of Sri Lanka, University of Southampton Clinical Informatics Research Unit, and the Princeton Frugal Innovations Accelerator. Commonwealth Center for Digital Health always value contribution made by our partners and is immensely grateful for the support and motivation provided throughout our journey. I would also like to mention a few key individuals who have significantly contributed to this effort. Mr. Tony Singaraya, our Chief Commercial Officer and the founding partner of the Analogy USA, played a significant role in bringing these awards to what it is today. And on behalf of the Commonwealth Center for Digital Health, I would like to thank you for your hard and dedicated effort. I would also like to mention Professor James Batchelor from Southampton University, Brian O'Connor and Andy Bleeden from the European Connected Health Alliance, Ashley McKean from the BMJ, Roshan Heva-Patirana and Charmika Senanayaka from ISIL, Sachindra Samaratna from the ICTA for their immense support during the webinars and other activities leading up to the awards, as well as during the awards. In addition, I would also like to thank all the applicants who responded to our call and complied with all our requests leading up to this event, and being present today, not only witness their own achievements, but also the achievements of others. Not all applicants can walk out with Winners Award. However, Commonwealth Digital Health Awards is unique, as winning or losing does not impede the ability of innovations or a startup to go the distance with our support and networking. We hope to journey with you and be part of your success so that this impact of your innovations will be felt by all across the globe. This event wouldn't have been reality without a visionary leadership. I, for this, must thank Professor Vajra Disanayaka, Chairman of the Commonwealth Center for Digital Health, for his guidance, which has inspired many all over the world in making a mark in the field of digital health. In operationalizing an award process at this magnitude and meticulousness requires a lot of human resources. We were amply supported by a dedicated group of doctors from the Biomedical Informatics and Health Informatics programs of the Postgraduate Institute of Medicine of the University of Colombo. I thank you all for your enormous support without reservations during the past several months. I would also like to thank Dr. Charmika Senanayaka for coordinating and managing all the technical resources, Drs. Chamara, Prasad, Ashan, Rukshan for developing video content and managing social media, as well as Dr. Kaushalya Mendis for comparing. I would also like to thank the AV unit of the Faculty of Medicine, University of Colombo and Dialogue PLC for giving us the venue to host and stream this event. Last but not least, I thank the biomedical informatics community in Sri Lanka, all the well-wishers from across the Commonwealth, as well as all those who are present today to witness this year's award recipients. Until we meet again at the Commonwealth Digital Health Awards 2023, I wish you a pleasant day ahead. Signing off from Colombo, goodbye.
Thank you, Dr. Siribardana. And that brings us to the end of yet another successful Commonwealth Digital Health Awards. Congratulations to all the finalists and the winners. Good night.